For me, every program is a little nuanced. I do nursing, allied health, health studies. So I also cover for myself respiratory therapy, radiography, other disciplines. So I knew about trajexis, but what's awesome to me about it is that I can have clinical preceptors and clinical faculty who sit in the hospital as adjuncts, and they never need an FDU email address in order to evaluate the students. That is a huge plus, because we just onboarding them to our system just to get an email address and then and having them check it is just a conundrum. But this way they can evaluate students on their phone without us converting them to an email address. That's very useful because we're partnering with big hospital systems, networks, where in many cases we give voluntary appointments to their faculty. We could turn an appointment around in a day now, which used to be a 5-6 week window. When you're scaling nursing programs, that's a huge piece. So that was important. Then we could really standardize and I can keep track of, without going into 20 different Blackboard courses, I can really confirm, assure that the clinical evaluations that our students are getting are standardized, that they meet the program outcomes, that they meet the course outcomes. When you leave it to the faculty to develop evaluation tools for the clinical, sometimes they get pretty far off track and they make adjustments to what was a good tool into a not so good tool. So if everyone's using this product, it takes me no time at all whenever we want to do our annual review to make sure that our systematic evaluation plan is matching, our outcomes. It takes me no time at all to go into trajexis, pull those final evaluations, the place where we're capturing the end of program student learning outcome or the end of course student learning outcome, and confirming that we are asking the questions that are on our original, on our original plan. So that is huge. For accreditation, this has been a game changer, primarily with Jackie, who has been nothing short of a godsend for us. We have a lot of faculty who have been clinicians their whole life, and to make the transition into academia where they have to really consider outcomes and how the program objectives relate to a measurable outcome. That is not really how clinicians think. They sort of address the tyranny of the day, as I like to say. And this tool for us in large form is about evaluating outcomes. That said, a lot of my faculty have had a hard time making the transition to thinking about how the questions we're asking students must tie back to a course objective. And there've been a lot of phone calls. And on top of that, we have technology issues, of course, because we're, a lot of my faculty are, seasoned nurses who haven't, grown up in the technology era. So between the calls about technology and where to find things, and it's a huge enterprise. I deal with maybe 100 different faculty and preceptors, and however may be. There's always a couple of early adopters. There's a lot of people that are in the middle, but then there's always a couple that are very late to adopt, and they're calling for support. Jackie has been terrific. She has had the patience of a saint at all hours with all people and directing people in the right way. The fact that we converted an entire school, which I'm going to say was well over 100 people, maybe even over 200 people in a matter of 2 months, is really amazing.